Hi, folks. Good afternoon, everybody. Happy Republic Day. Today, I'm glad to share some evidence based research, pain science on chronic musculoskeletal pain disorders, just calming down the system called mindfulness based training, mental training to alleviate the chronic pain, how to modulate the pain. As we all know, low back pain is highly prevalent in all ethnic backgrounds and all age groups, and it is proved to be a main challenge in this area because it is more high prevalent rate and obscure etiology. If we know the source, we can treat by comprehensive biopsychosocial model and effectively to the patients who are suffering. I have noticed many times in my practice and also many experienced physiotherapists are getting struggle in this specific area. There are umpty number of evidences in mindfulness based mental training to calm down the nervous system and works like a charm to get absolute reversibility by this base of training. There are many school of thoughts and various methods which has been designed by pioneers in physiotherapy field. There are best source of clinical practice guidelines based on best available evidences for the modulation of the pain in musculoskeletal pain disorders. Growing trend is now patients started seeking directly or via referral to the physiotherapist. That makes us more responsibility to give a proper high quality care to the patient. In case of psychosocial problems, which is called as yellow flags, we need to address how effectively this biopsychosocial model plan of management can be helpful. I work with this area mainly on patient education, right choice of exercises, and dosage are the most critical part of the management in physiotherapy, especially in chronic pain management. However, this is also attributed to acute pain sources also. How to use a valuable information tool in the acute pain sources also. However, this important thing is more time consuming and more fascinating methods, patient education and lifestyle modification, which plays a key role in chronic pain management and also proves best functional outcome measures. Why I am indulging this mindfulness based training, which is a yogic practice in this musculoskeletal disorders like low back pain or cervical pain, something like that. Mainly in the total frame of work of biopsychosocial model, you can get psycho as well as social on depression, anxiety, and frustrations, fear, as well as social avoidance, cultural avoidance, and financial problems. All this which makes a bigger of biological problem like pain as well as movement dysfunctions, all are biological sources. So the psycho and social which instigate this biological problems more. So how to calm down the system by means of cognitive functional therapy, as we already discussed in various videos about how to give functions, how to avoid the fear. Indulge in that particular practice, mindfulness based training, which is a best important lifestyle modification. I have consulted three experts. Number one is Shelley Prosco. She is from Canada. She is a good friend of mine and she shared some views about this mindfulness based training. There are a lot of evidences to be proved, and she is working with her team and she has written two three books and different varieties of articles, and she's having a good evidences of better outcomes in mindfulness based training. And I have consulted another important person called Mr. Selvaraj. He is based on Pudukkottai and he is also a research in yoga. He's doing a lot of applied yogic practices and meditations. And I have astonished so many elderly peoples with musculoskeletal problems getting rid of a back pain or neck pain, as well as getting wonderful relaxations by his way of meditation practices. So I approached him. He also given it gives a wonderful relaxation and improves the immune system, and brain functions are calming down. So, what he told is exactly implicated in the research. So, I started wondering, and very interesting to go on research works. So, I've go through with the support of Shelley Prosco to Zedel brain mechanism research articles. Dr. Fedel Zeden, he is a PhD neuroscientist. He has done 500 research articles and he has been proved through functional magnetic resonance imaging MRI that this meditation mental based training which produces lot of changes in the brain, especially in prefrontal cortex, limbic system, amygdala, and anterior cingulate cortex. There are lot of changes happens in pain ratings. Say for example, if the patient with acute or chronic pain with severity of 10 centimeter scale in visual unlock, if you do a mental based mindfulness training for 20 minutes daily, and it has been experimented for 1 week or 10 days, after that the pre and post functional MRI has been taken. So this gives the drastic change in the brain, especially in frontal cortex. So medial frontal cortex, anterior cingulate cortex, as well as this amygdala. Total base of the brain is the limbic system, calming down, and completely a reversibility can be occurs. So totally there is a calming down of the systems with the pain which is produced by emotional as well as some sort of anxiety and depression and some life stress events which provokes the pain, not only by means of biological, also by means of psychological models also. So that is called a central sensitization, top down system. From the brain the pain is activating. So this has been calmed down by this mental based mindfulness training. So how this has been happened? What research this Dr. Fidel Sidon have done? He has been selected a group of peoples and subdivided into three types of categories. Number one is mindfulness based training for 20 minutes. Number two is sham meditation. Number three is placebo analgesia. Just giving a word of mouth and applying analgesia cream and calm down. And number three is sham meditation just for 3 minutes, closing the eyes and focusing on the breath and concentrating thoughts to be avoided, diversifying thoughts, just 3 minutes. And number one is mindfulness based training. So the mindfulness based training is non judgmental, non relevant, completely focused on our breath. This is the wonderful definition given by Dr. Fidel Zeden. Fidel Zeden has done his PhD in neurobiology and psychology, and he has presented TEDx, a great important pain science. So in that he has done a wonderful presentations also. So now I am speaking about his presentations, how he has done this wonderful research works on mindfulness based training. So mindfulness based training is a wonderful training which has been given to calm down the system. He has been done through the School of Medicine, Winston-Salem in USA. So how this has been activated? So mindfulness training consists of two types. One is focused attention called as samatha, samath in Sanskrit, which is focused on specific object or sensation of flow of breath. And next is open monitoring, which is called as vipassana, which is directed towards sensory and cognitive events. Complete lack of consciousness, totally, completely become silent. So this too can be experimented 20 minutes. Mindfulness meditation related to pain relief, evidence for unique brain mechanism in regulation of the pain. This is the wonderful article he has been done among this 500 research articles on 2016. It contains 16 pages. I have gone through his 5 articles. Among them, this is the best thing that I have selected to give a speech for you all the peoples. So this mindfulness based training, which gives changes in the gray matter, changes in the limbic system, changes the reversible to the certain amount of reversibility occurs. So meditations understanding from prefrontal cortex make the patient less anxious about the pain. That is very, very important. So the brain prefrontal cortex, preoccupants, posterior cingulate cortex are the mechanistic target for the mindfulness therapies. So greater deactivation of posterior cingulate cortex and lower the pain ratings, as I have told, 10 centimeter come down to 3 centimeters or no pain. And next, unpleasantness, some sort of irritations, some sort of avoidance behavior, all this can be come down to pleasant nature. So fMRI proves, functional magnetic resonance imaging proves, after the study of 1 week of 20 minutes focused attention and open monitoring meditation, it has been proved top-down activities, as I have told, from brain to produces pain. See, there is a analysis called as arterial spin labeled analysis, through which he has been analyzed decreased pain sensitivity and increased anterior insula and middle cingulate cortex. Finally, the pain intensity will be decreased from 10 centimeter to 3 centimeters by means of increasing orbitofrontal cortex activity and decreased sensory perceptions in thalamus and decreased pain unpleasantness. So the mindfulness related pain reduction promises to be an important tool for understanding the sensory events, and it is used also in physiotherapy field as an adjunct to concurrent this base of acute as well as chronic pain. And what are all the messages that we are giving to the patient? Valuable informations like how this pain which happens, how it can be get rid of from the body, which is a temporary, like educations that we are giving. Along with that, this mindfulness training can be indulged in clinical practice with the based on the exercises dosimetry as well as this training, or we can seek a help of yogic therapist like this people's pioneers in yoga like Shelly Prosco and what I have been told Mr. Selvaraj as well as Dr. Fedelsidon. So these three peoples are doing a wonderful practice on chronic pain managements, as well as we can incorporate this in physiotherapy, especially Dr. Peter Sullivan also incorporate his practice of cognitive functional therapy with mindfulness based training. So this has changed drastically the reversible activities of brain functions and calming down the limbic system by means of anxiety will be reduced and pain and unpleasantness will be reduced. So why don't we take this as a chronic pain management for modulating the pain function in our daily practices. Of course, it is a time consuming work, but we have to utilize for certain patients who is having a central sensitization problem. So like yellow flag psychosocial issues, we instead of using the education, reassurance and valuable information, along with that this mindfulness based training also very important tool. I have posted 3 images of this experts as well as this research articles about my post. So please keep going on this, and if you like this video, please subscribe me. Thank you. Wish you all once again happy Republic Day. Thank you.